Good evening. There have been more warnings today that coronavirus is spreading fast across the UK. Government officials have warned care homes that there are signs the virus is spreading from the young to the old. And a scientific advisor to Downing Street has told Sky News a second national lockdown could be needed if the numbers keep heading up. Well, in France, the number of new daily cases has passed 10,000. Here are the latest figures for the UK. 3,330 new cases of coronavirus have been confirmed in the most recent 24-hour period, and a further 5 deaths within 28 days of a positive test for the virus have been announced. That brings the total number of COVID-related deaths in the UK to 41,628. Well, our health correspondent Ashish Joshi reports.
At the Shinfield care home, there's a sense of unease. The country's growing infection rate is a threat to the residents here. But the staff are prepared. They're confident their residents will be protected. That's a relief for Sharon. Her mother, Betty, who has dementia, lives here.
If I don't get to see my mother again for a long period of time, it will be heartbreaking. She's nearly 80 years old, and my father-in-law, my stepfather, he passed away with COVID in another care home. So that was heartbreaking as well. But if it's on the rise, I think as long as these guys do continue to do what they're doing, I know Mum will be safe.
The government's failure to protect our most vulnerable is one of the greatest scandals of this health crisis. Infected patients were moved from hospitals into care homes, exposing staff and residents, leading to many preventable deaths. Stuart Miller, the government's director of adult social care delivery, has warned care home managers of a rise in infections, urging them to take the necessary action to prevent and limit outbreaks. Currently, the infections are mainly affecting the workforce, but clearly there is a risk the virus will spread to care home residents or to other parts of the care sector. Unfortunately, in some care homes with recent outbreaks, this does appear to have occurred, with residents also becoming infected.
It's a bit like water seeping through a dam. You know, it starts as a trickle, and if you don't do something about it, then it can turn into a real sort of cascade. It's back in care homes as well. So, you know, we know that these are very vulnerable pockets. It's not just in the younger people. It's starting to appear in people who are more vulnerable. And that inevitably is going to be followed by hospital admissions and deaths. So, you know, we need to act quickly. And this isn't a game. You know, we shouldn't be out trying to party as hard as we can in the run-up to Monday's lockdown. We should all be really thinking about what we can do now to slow down the spread.
The spread of the virus can only be curbed by fast and reliable testing. But the government system has come under fire again after many people, like Sylvia Tellax, failed to book a test.
She had a high temperature. She then started to cough. They turned me away.
She was desperate to find out if her daughter Ava was infected after she started showing symptoms. What is it that concerns you most about the lack of testing capacity?
The government decision makers, I can't see how they can initiate an accurate response to manage the spread of the virus if the numbers of people getting tested, whether they be positive or negative, aren't an accurate representation of the local area.
At the start of the outbreak, nobody knew just how deadly this pandemic would be. We've learned the hard way about protecting our vulnerable. This time, there will be no excuse for failing them again. Ashish Joshi, Sky News.
Now, ahead of another week of crunch Brexit talk.